CPT surgery, nervous system, neurosurgery. Neurosurgeon will be performing the surgeries on brain and spinal cord, and also peripheral nerves. If you remember anatomy, the nervous system is divided into three divisions: the central nervous system, including brain and the spinal cord, and the peripheral nervous system, the nerves that are coming out of the brain as well as spinal cord. So, the brain we have the lobes, the frontal lobe, parietal lobe, temporal lobe, occipital lobe. There are other parts also. Inside the brain, we have the ventricles, which secrete cerebrospinal fluid. Right? This is the anatomy of the brain, and the extension is spinal cord within the vertebral column. And the spinal cord is divided into the cervical region, thoracic, as well as lumbar, sacral. Right? These are the portions of the vertebral column or the spinal cord. So now let us see the procedures on brain. What is the covering layer of the brain? We have the covering layers for all the important organs like heart as well as the lungs. Similarly, we have the for the brain that is called meninges. So the meninges again there are three layers: the outermost dura mater, arachnoid mater, pia mater. The three layers of meninges, which enclose the brain, right? And the skull will protect, right? The cranium will protect entire the bony portion, entire brain, as well as the vertebral column. They surround the entire spinal cord. So the vertebral column or cranium, their responsibility or their function is to protect the sensitive organs, including brain and spinal cord. So this is the anatomy of brain and spinal cord at a very high level. So you remember these names: the lobes of the brain and the layers of the brain, plus the surrounding skull bones within the head region. Now coming to the spinal cord, the divisions of the spinal cord plus the vertebra surrounding the spinal cord. So let us go to the CPT, how it is arranged. So you see here the same way: skull, meninges, and brain. The procedures on the skull, meninges, and brain. That's how it is arranged. Once this heading is over, then spine and spinal cord, vertebral column and spinal cord. The procedures. So then we have procedures on um, nerves, peripheral nerves, extraocular nerves, peripheral nerves, and autonomic nervous system, visual nerves. So this is how the codes are arranged. So these peripheral nerves, yes, let's go through these peripheral nerves, the important nerves, the brachial plexus. No, we have names for different nerves. Nerves within the upper limb as well as lower limb. Here we have the brain anatomy, the lobes, frontal lobe, parietal lobe, this is occipital lobe, and temporal lobe, cerebellum. So these are the ventricles which secrete cerebrospinal fluid. So here is the pituitary gland, pons, brainstem, and it is continuing as spinal cord, right? The surgeon will be performing on these parts, either frontal lobe or parietal lobe or temporal lobe. All right. So neurosurgery is very complex surgery. Um, from coding point of view, let us try to simplify it. Even it is complex than even cardiovascular system. So this is the different parts of the skull bone, like frontal bone covering frontal lobe of the brain. The parietal bone covering parietal lobe of the brain, right? So the bones and the lobes are the same name. Frontal lobe of the brain, frontal bone. Parietal lobe of the brain, parietal bone. This is temporal bone, temporal lobe. Occipital bone, occipital lobe, right? That's how it is named. Similarly, on the vertebra side, cervical vertebra, then we have cervical spinal cord. C1, C2, C3, C4, C5, C6. Similarly, thoracic, T1, T2. So the names of bones and names of the brain parts as well as spinal cord parts are same. That's how it is. So here are the again different parts of the brain, lobes. So here also to understand surgical procedures, surgical diseases, they are very important. Surgical diseases. What are the surgical diseases? Again, so what kind of conditions with which patients they go to neurosurgery? Yes, you have the answer. So we'll start. We'll discuss about the procedures on brain. Now, if the brain is function is normal or structure is normal, then they don't need any surgery, right? So if there is structural problem,
Yes,
yes, for the same.
40%. Yeah.
Yes, abscess, tumors, cyst. These are all the um, diseases for which surgical treatment is required. Now here is the meninges. Any tumor in the meninges also requires the surgery, isn't it? Now inside there is the ventricles, which secrete cerebrospinal fluid (CSF). Sometimes what happens, the secreted CSF is it's a continuous cycle. The CSF is secreted and absorbed. That's how the normal quantity of cerebrospinal fluid is maintained. So imagine absorption is there is no absorption at all. It is secretion is there, but there is no absorption. What happens? Is there is a production of fluid, right? CSF fluid. It's continuously secreted. Secretion is there, but there is no absorption. So what happens? So there will be accumulation of fluid. It will increase the size. Now that is called hydrocephalus. Please make a note, hydrocephalus, where accumulation of CSF in excessive quantity. So for which again surgery is required. So for every surgery there is surgical indication. Reason for surgery, the disease. That's important. Now the brain is inside. Here is the frontal lobe. There is a tumor. Now to do the any procedure on tumor, first thing they have to cut open the bone, right? So that's how they do it basically. For example, there is a blood collection here because of head injury. Now the collected blood you have to take out. So it's not easy because there's a bone, cranium, skull bone. So any procedure on the brain involves first thing to cut open the skull bone. So for that we have CPT codes. So if it is a percutaneous approach, closed approach, they will have this is an instrument called drill, burr hole, burr. These are the instrument with which they make a hole and they take out the blood or biopsy or whatever. But if it is an open procedure, that to cut open this entire bone, that is called craniotomy, craniectomy. If they're creating a hole, that is called hole. If they're removing the skull bone, that is called craniectomy or craniotomy. So let us see. These are the procedures on cranium and brain. Crystal, burr hole, refine. So these are the instruments with which they open the skull bone and they reach the organ. Craniotomy, craniectomy, lobectomy. So these are the basics you need to understand first. Then you have to go for advanced topics, isn't it? So let's see these procedures. So we are in the skull, meninges, and brain, and Israel, Barhold, fine. They're drilling a hole and to reach particular brain portion per hole, fine. Biopsy of the brain or intracranial lesion or drainage of brain abscess or cyst. So these are the simple procedures you have to highlight first. Then you have to go for the advanced procedures. If you go directly to the advanced procedures, you will get confused. So just highlight these procedures in your book. 61140, 61150, 61151. These are the basic procedures. They're creating a hole and they're taking the biopsy. That's how it is basically. Now, open procedures. Craniectomy, removal of cranial bone or craniotomy, opening the cranium. 61314. Craniectomy or craniotomy for evacuation of hematoma, infratentorial, extradural, subdural. So they are dural, extradural, subdural. They are referring to the meninges. What did we discuss in the very beginning? There are meninges, right? Dura matter. Above the dura mater, that is called extradural. Below the dura mater, that is called subdural. If the hematoma, blood collection, it can be under the dura mater or above the dura mater, right? That's what they're referring to. Either extradural or subdural. So infratentorial, intracerebral, again cerebellum is another part. This is intracerebral within the cerebellum. This is within the brain. So just you have to go through these all these procedures. I mean, but I'm giving you the important procedures for which you need to understand the codes. Now this is more extensive. Craniectomy or craniotomy, drainage of intracranial abscess, supratentorial. 61320. See the difference between 61320 and this one 61154. In both the cases, they are doing evacuation of hematoma. This abscess 61320 abscess. This one 61150. Both are abscess. But what is the difference? This is burhole. Approach is burhole. Here, this is craniectomy. Okay, that's the approach. 61322 323. Their lobectomy. Entire lobe is removed. Here, they are doing craniectomy. So, only thing is regions are different. Sometimes they are doing procedures on this frontal lobe. Sometimes they are doing on temporal lobe, parietal lobe, occipital lobe. Surgeries of the skull base. This skull base. This is a skull base. So if you see here, this entire head region, this is brain, and here is a face, right? So this portion is called skull base. So imagine there is a tumor in the skull base. It is still difficult because if this tumor is here, then you can just cut open the cranium, skull bone, and remove the tumor. If the tumor is here, it's getting complex, highly complex. Somewhere here, for example, this is the base of this skull, somewhere here. So for those complex procedures, we have of course, surgery of skull base. For this also, you should know what is the region, what is the approach. Approach procedure and definitive procedure on which lobe, which region. So we have anterior cranial fossa, posterior cranial fossa, and middle cranial fossa. What do you mean by that? This is you're talking about skull base here, this portion. This is anterior skull base. This is middle portion. This is posterior fossa. That's what they are. So first thing we should know which region the surgeon is working and what is the approach and what is the definitive procedure. Still, we have a lot of complex procedures, um, but from only highly experienced coders they will code these procedures. So you have to look at this surgery nervous system from examination point of view to be able to identify the code based on the procedure with the help of index as well as the table of contents. Yes, of course, to go through these with the help of examples. We have given a lot of examples. Um, if you just go through those examples, yes. Then we have procedure on spine and spinal cord. All right. So what we do, we'll review these.